Hi everyone. Today I'm with Jamie, and Jamie is
A clinic manager at the Warrington site.
at the Warrington site. And how long have you been with us, Jamie?
So I started at the end of February 2025.
February, so not that long.
No,
Oh,
not that long.
Okay, and are you enjoying it?
Yeah, I love it.
Love it.
Love
Great,
it.
that's what I like to hear. So what were you doing before?
I was a GP receptionist in the NHS.
For how long?
5 years.
And what happened there?
It was just the same thing every day. I felt like I was going home miserable, letting patients down, sort of not really making a difference as much as I wanted to.
Right.
Because
Okay.
there just wasn't the option to.
And then for some weird reason you picked us, the madhouse.
Yeah.
Okay, so we're the other extreme of that. We're all too happy all the time. Okay, and then you've been here since February.
Yeah.
So we discussed this earlier. You have a personal connection to this place now.
Yeah.
What is that?
My mum.
Right?
Yeah. She has had dentures for 15 plus years. Really struggled with, she'd never come out for family meals. She won't meet any friends. Anything that involves sort of eating and sort of a lot of even just speaking, just because she struggles to speak with the dentures in.
Right.
General, like, just unhappiness.
Just general and hiding
Yeah.
herself away, you know.
Just didn't want to leave the house.
Yeah.
Just really sort of not from what I remember her being like when I was younger.
I remember interviewing her, and she told me that she takes jobs where there's no one around.
Yeah, so she actually didn't work for a while because she was that embarrassed by the situation. And then she got a job, so it's in a shop, but when it's closed, so she doesn't see any like customers.
Wow. Unbelievable. So anyway, so you go home and say, Mum, I've got a new job.
Yeah.
Right? And you tell her about it, and her ears prick up.
Yeah.
Right. Okay, tell me about that.
So she just sort of asked me what I did because she's seen a massive difference in me from when I started here compared to my old job. So I explained, and then I introduced her to the Facebook group, and she started having a look on that. Sort of just picked it up herself really. I could see her looking at liking things, and I was like, have you been having a look? And she just said that she was genuinely amazed, and it had sort of given her some hope because she'd been told no before.
So she's been told no before?
Yeah.
And how long ago was that?
So long ago, like, I think I was only small, so it's probably like 10 years ago even, and even then she was told, you've not got enough bone.
You've not got enough bone, right. And then she just pretty much gave up?
Yeah, she just gave up from that point. She didn't.
Right.
She just.
And now she's
No.
waiting for the day.
Yeah, she's
Waiting for it, looking forward to it, counting it off.
In disbelief, and you can see the hope's been restored in her. And
Yeah, but the bit I find very odd is the whole in disbelief thing.
yeah,
Because I've been doing this for 25 years. It's
Yeah.
not like it's new,
no,
you know, it's just 25 years. It's a
Yeah.
long time. It always staggers me that people don't know. So you were working at a GP practice, right?
yeah.
Now looking back, how many people were walking towards you who you could now look at and go, you need this?
Yeah, quite a few.
Quite a
yeah,
few.
quite a few.
They don't know.
No,
Nobody knows. And that's the problem. That's the big challenge for us in how do we get everybody to know that there is a way out. We understand, you know, it's affordability and all that, but at least knowing it's possible is free.
yeah,
Why doesn't everyone know it's possible?
yeah.
That's the bit that winds me up.
I think it's crazy as well because a lot of the people that were coming in, a couple said the problem started from dental problems, the actual health problems started from having dental problems.
Well, it's one of the things that we're going to be talking about, the connection between oral health, heart health, brain health, digestive health.
Yeah.
They're all connected. People just aren't connecting it up, but we connect it up. So the main reason we do our job is so that they're healthy. They just happen to look prettier at the end of it, but that's not the reason we're doing it. We're doing it so they can be healthy and back to health.
Yeah.
When are we treating your mum?
The 14th of August is her surgery.
Yay!
Yeah.
Is she going straight to LTP, right?
Yeah.
Whoa!
I know.
That's going to be a very cool day in your house, I tell you I'll bet you anything, right? She'll be doing things at home that I call the Elvis grin. So you know when they've had dentures for ages and they've not smart, they start doing this rubbish because they don't know what to do because they haven't done it for years.
Yeah.
But you'll have that going on for a few days, and then you'll hear some nonsense like, "I think I'm talking funny." Yeah.
Yeah.
Don't worry. You'll talk less funny tomorrow, and then
Yeah.
the day after, and then the day after. But you're going to be living with it in your house, and you're
Yeah.
going to get a perspective of what our amazingly brave patients go through.
Yeah.
To pluck up the courage to let us do what they definitely need, and then go through that process of adaptation.
Yeah.
And then if we have a conversation again, 3 months after she's had it done,
Yeah.
we'll have to remind ourselves what she used to be like.
Yeah.
Because I met your mum.
Yeah.
I know what's coming out once I do this.
Yeah.
I know the party animal is going to come out. The thing that's been locked up for a while, she's going to go, boom. I can see it. I can see it. I can see it. So on a day-to-day basis, you've got people coming in here, like your mum, right?
Yeah. Every day.
Telling you what kind of stuff.
Just say similar things, that they've had no hope all this time, that they're just nervous, and then they've discovered 21D, discovered the videos that we do, and again, just a lot of disbelief that it's possible.
How do we get over this disbelief thing? How do we do that? I don't know, it's frustrating.
Yeah.
Me, because I'm putting everything out there. I'm going, this is what the science says can be done, and it's still disbelief.
Yeah, and then when they come out of the FCA, they're just...
Are they the same people?
No.
So you know they go in one way, what happens? So they go into this magic room, right?
Yeah.
And then they come back out again.
It's amazing to see the difference from when they first walk through the door to when they come out of the clinical room, just how much more at ease, and how they just seem to be amazed that...
General relief.
Yeah, relief,
That
that's the
there's a
word.
way out.
Yeah, the relief.
Right.
And when they've got that yes, the happiness.
I just want to clear this up once and for all. I want to, and we work very hard to say yes to everyone that needs it.
Yeah,
But we'll always say no to people who just want us to take all their teeth out for no good reason at all, because that's mental.
yeah,
Right?
Yeah.
We've had a few of them, and we tell them things like, your teeth are great.
yeah,
We're not going to take them out.
yeah,
And they get upset with us.
yeah,
Would you go to your doctor and say, I've got a headache, will you cut my head off? And they go, no, all you need is paracetamol. Would you then get on Facebook and go, my doctor is horrible because he
Yeah,
won't cut my
no.
head off? What?
no. And I feel like that's a big difference as well that I can see here, is that we try everything possible to always help the patient.
I've always had the view that, okay, maybe other people can help them.
Yeah,
I've always had the view that have we tried hard enough to help them,
yeah,
that at least they've got one reference point that can definitely help them. Then if they've got 4 different people that can help them, then they can choose. I don't want to be the guy who destroys the hope, and I don't want to be the guy who says you can't have something that you definitely need
yeah,
to live a good life. I don't want to be that guy. But equally, if it's unsafe,
yeah, no,
yeah, I'm not doing it.
yeah,
Because what's the point of having a nice set of teeth for the coffin?
yeah,
That's pointless,
yeah.
right? So you really, it's different. But you see the change in them when they come back
Yeah,
out.
the change is massive.
And then you get to work with the wonderful nurses and the not so wonderful clinicians, right? Some of them need a bit of an attitude problem, a lot of them. And you get to see this emotional roller coaster on a daily
Yeah.
basis. And you're still telling me you go home happy,
Yeah,
even if you're at the blunt end of raw human emotion, you still go home and feel happy.
yeah, just every day, and sometimes can't get enough.
Can't get it.
Yeah,
How weird
even
that
with,
sounds. Okay,
even
all right,
with
yeah.
patients on the message on a weekend, and
Message on a
and
weekend,
you're like, oh, nice to hear you're getting on. It's just really,
but they're messaging you
yeah, well, like our team, yeah,
at your team.
Yeah.
But you know why? Because you're people they can trust.
yeah,
You understand? You're people that they feel like they can turn to.
yeah,
And that's, for me, I so dislike this terminology, especially in a medical environment. of a receptionist. Receptionists work in offices, okay? Clinic managers are actually not managing the clinic, they're managing the people who are coming in and out of that clinic emotionally.
Yeah.
Now, you know, if the job you used to do before you came here, could they do with a bit of how we do things here over there?
100%.
What do you think would change?
Just the whole attitude of the patients. They would feel like they're being listened to.
And that's,
being
they
cared
didn't
for.
feel like they were being
No,
listened to. It's just
definitely not.
shove them in,
Just
shove them out.
shoved on to the next. Yeah.
Yeah, well, hopefully we'll make enough of a dent to change a few minds. Great. Thank you very much for your time, Jamie.
No problem.
Really appreciate it.
Very welcome.